Welcome back. The healthcare debate, the battle rages in Washington, but the effects are in our local cities across the country. I cut you off before we went on a break. What were you trying to point through?
Well, he was making the point
the single payer
about the single payer option.
Right.
Now, many feel, and I know from the Republicans' perspective, because we believe in free market, free enterprise.
Yeah, but and free market, free enterprise, the trust of it is competition. So why are they afraid of competition?
Because they don't feel that they can compete against the government who has our tax money at their behest. Because private insurers have to make payroll, they have lights, gas, they have to pay taxes, federal and state taxes. The government doesn't have those overhead costs, so they would inherently be able to underbid just about anyone.
Well, first of all, that'd be a good thing, but just a minute for one second. We agree that Medicare is a program, right? A government program, public option?
Yes.
Right? Well, right now, Medicare, their revenues, 2% goes to administrative costs. In public companies, 15% go to administrative costs.
Okay. Are you
done? No. Well, my point is,
I'm not disagreeing with
that. They're spending that kind of money. Where's the competition? Where's the problem?
Well,
I think the government thing is a little better than the private public companies.
Well, one of the things is, if you look down the future, where does this end? Where the government competes against the private sector and puts them out of business in, say, producing aircraft or anything else. Here's my perspective on what you just said. We inherently have health care problems that have to be fixed. As I said earlier, we cannot continue to do the same things and expect a different result. That's not going to happen. What we need to do is, we know Medicare is underfunded. We know state Medicaid, because I was at the state. The governor, I know what she's trying to do by help. The problem is, when you have more people on it and the state don't have the finances to make the match to bring in federal help, where are we now? We need to go back and start top to bottom. I believe recently the VA system was, they fired that general and hired somebody new.
Is the VA system a better alternative?
No, I don't say it's a better alternative, because it inherently, as I said earlier, and just like in Medicare and Medicaid, we need to go back. Instead of a top to bottom fix, we need to go back. And we need to start where we know these problems occur, address those issues, and there's a segment of the population that we do believe we need to address. They need health care.
Well, I'm going to disagree with you slightly. I think we need to reform the entire health care system in America, that we can be on page like other, people say the civilized but industrialized nations, where they take care. We have to look at, again, we're talking about Senator Kennedy, what is right? You know, health care should be a right. People should not be able, insurance companies should not be able to say, okay, we're not going to insure you. We're not going to pay for that because you have this pre-existing condition. We need to change those kind of things. We need health care reform from top to bottom. Now, it's not going to happen overnight. You know, as a matter of fact, with the bill states now, it won't be going into effect until 2010, the next presidential election. But we need to start now and get out the politics out of it and do it for the right reason. It is the right thing to do.
The point that you just brought up that we spoke to earlier, and we totally agree, and like we said, we agree that there is a health care crisis and a problem. The pre-existing condition, I would be hard-pressed to not see that the private sector in insurance doesn't see a law coming that does not occur anymore.
Do you support a public option?
To an extent. I don't want them to compete with the private sector where it puts them out of business and everybody goes to the public option, and now we've got just federal health care.
But how about competing? Would it bring their prices down?
That's what I agree with.
Okay, and that's what we're trying to do. And
again, that's what I agree with.
The bill says if you like your insurance, you can keep it.
That's exactly what I'm going on.
All right.
Let me say this. Do you think that this administration, the President Obama administration, can meet the September 15 deadline?
I don't think so, because the Republicans won't allow it to happen. The Rush Limbaughs, the Glenn Becks of the world, I don't even talk about the legislators, because I don't think they'll be able to stand up to the groundswell of the misinformation that's going out. No, I don't think that happens.
And you know, what the interesting thing here, John, is that during the funeral of Edward Kennedy, you know, all the major Republican leaders, John McCain, Orrin Hatch, they all talked about how great he was, and, you know, bringing them to the table on the key issues. So, and these are actually the key lawmakers in the U.S. Senate who will be very instrumental in crafting a health care plan. So the question is, where is the spirit of Kennedy if we're not going to meet the September 15 deadline?
Okay, well, I'll tell you, I can't remember anything that was done in haste and was done correctly. We created Blue Cross under PA 350 of 1980. Well, look what's happened to Blue Cross. Now you have other people, I would say like other entities such as DPS, DPOA, Oakland County, suing them for overcharging. So there's things that can run astray. I think that this needs to be well thought out. I think everybody should come to the table, whether it's the doctors, hospital administrators, administrative, and everyone sit down at the table and vent where they feel the problems are so we can come to common ground. It's like I say, the world don't work in the black and white. The world works in the gray area. If you're prepared to take me to common ground, I'm with you. But if it's just my way or just your way, I don't see that common ground, and this is where Ted Kennedy took us, to the common ground.
But also seeing the urgency that we needed, this needs to be done. And didn't just start with Ted Kennedy or just start with President Obama. This has been going on for years. Again, Walter Reuther started talking about HMOs in the 1940s. But I think what needs to happen is that what you've already said, I'm sorry, it's already happened. Yeah. President Obama has sat down with the different health agencies, with doctors, with the insurance companies.
Stakeholders,
right, the stakeholders in this. The President Obama has started trying to do that. Again, the politicalization of this process was killing this process. We're not having fact-based discussions about, I mean, we have differences. And that's what we need to do as Americans, make sure this bill works, but it needs to be based on facts.
With what you just said, what was the deadline you mentioned? September
15th, right.
You see, when you put a deadline to something that is so intricate, you know, I know that he's trying to put a deadline on it to move people to common ground, and I agree with that.
I have to go.
Yeah.
I have to go. We're rounding up. That brings us, thank you very much for coming on Center Stage. That brings us to the end of the first edition of Center Stage. We'll continue this discussion next week, still on the healthcare crisis. We'll talk to a military veteran who went to war and came back with no health care. All of it on Center Stage next week. Thank you very much for joining us. I'm Bankole Thompson here on WADL TV 38. And don't forget to read my articles in the Michigan Chronicle newspaper every week.
Thank you.
Thank you. Definitely. That's good.